Thanks for also sharing. I've been listening just to Sheila's point at the end just now. And from the perspective of Freetown, as with many of the West African cities, we're in a different place in the curve of this particular disease. We've just hit the 500 confirmed cases mark, and the rate so far has been slower than the rates in the US. We had our first case on the 31st of March, and we're now in the middle of May, and there are 500 cases. So it's the transmission levels seem to be lower, but the impact is already much higher in terms of percentage of deaths. And significantly from the perspective of the city, we are seeing, as you might imagine, I was listening with interest, Sheila's points about people, particular communities, their innate difficulties, characteristics which make them more vulnerable to the disease. And what we've seen in Freetown is that we've got particular features of our city. The informality, the fact that we've got 68 informal settlements and 35% of our residents living in slum communities. So think of that idea of not having enough space in a home and shrink that home. Think of people, 11 people, 12 people living in what would be regarded as one bedroom in terms of size, and those being very closely packed together. So our population density in the city is 8,450 persons per square kilometer. Add to that 47% of people not having access to running water. And when you have an outbreak where a major preventative measure is your ability to wash hands, that becomes a real challenge. And another difficulty, I listened as Sheila spoke about people getting onto public transport and therefore being more exposed. 85% of our public transport is single occupancy or small occupancy. So what we call okadas, which are motorcycles, and those are motorcycles where the driver is in front and the passenger is behind, and the only way you stay on is by physically holding onto the driver. So talk about exposure, where 60% of our residents are traders in open markets, and where the markets aren't open, well, even where they're open or not opened, there's again a lot of density. So there are features which are built in, and we've got, in our case, a city government of a different political party to the national government. And unfortunately, where this should really not make a difference in a time of crisis, it certainly has. And the level of collaboration between the central government and the city government has not been as good as it should be. That notwithstanding, and maybe in a way, particularly because of that, as a city, we were quite fast in recognizing that it was important for us to develop a city-focused plan. So we have a COVID preparedness and response plan at the city level, which really speaks to our peculiarities as a city, speaks to the specific needs of our residents. So features its 3 strategic elements: behavior change messaging, behavior change support, and isolation and containment support. Really trying to ensure that those features, because it's the largest urban setting in the country, 40% of the urban dwellings or the urban settings in the country are represented by Freetown. So it was really important that we had a plan which spoke to our challenges. So the messaging is very community driven, and that's come out of one of the lessons we learned from Ebola, having communities at the heart, but also really targeting. So you've got the messenger as a trusted voice. So it means across the city, our counselors, community leaders, youth, women, tribal heads, religious leaders as well, but also moving up from across the city, also looking to special groups. So we're working with Ebola survivors who really have firsthand experience of what it means to have to face a disease like that, the stigma, and can really share and be a credible voice to people in the city. But the bike riders, you know, I just mentioned public transport, the market women associations. So with all of that, we have the messaging. But we move on to support. If you don't have water, how do you wash your hands? So ensuring that as a city, we're providing water, accelerating plans we had already under our Transform Freetown initiative to ensure that most vulnerable areas, hygienics, which are known as peripheral health units, as well as our informal settlements, we're accelerating the provision of water and hand wash stations to them. And when I say accelerating, it's not just bringing water in Bowsers because we don't have the running, the piping systems, but it's also thinking outside the box. So we're fast tracking plans we had to introduce rainwater harvesting, as well as tapping into underground streams in these communities. So helping to ensure that people can wash hands, working on our markets to bring physical distancing in, which means, you know, last week, Sunday, we had a drone fly over one of our biggest markets. And we have engineers trying to work out, and we will be rolling it out this week, how to redesign the way the streets are organized. You know, I heard about US mayors also, you know, sort of making streets pedestrianized. So we engaged the commercial streets, totally pedestrianized, called reality. Masks are playing a big role in our setting. With such challenges with the healthcare provision, we're really keen to promote the use of locally made masks. And it's a hard sell, but it's something that we feel we need to do in order to have an alternative to physical distancing. It's in many of our settings, it's physically impossible to have the luxury of a meter or 2 meters in between people. So we're really promoting the concept of everybody wear a mask, and it is a hard sell, but we're being persistent. And as a city, we're producing and giving away 120,000 masks. That's 10% of our population of 1.2 million people. Things like urban farming, kickstarting that in some of our slum communities, because government interventions have included already 2 lockdowns over 3 days. And when people live on less than $1 a day, and they only can eat what they can purchase that day, what they can earn that day, it's really important for us to build some resilience. Isolation and containment, the government is quarantining, but there are often challenges with providing food. It's late, doesn't come on time. And in our slum communities, we know if the food isn't there, people will leave those homes and move around the population. It's been really hard when people are asymptomatic to understand that they are contagious and need to stay within quarantine. So we're providing support there. But we are also seeing the isolation beds, the hospital beds, and we had done some projections some time back. We've done numbers, we'd used data, we'd done our analysis, and we knew that we're going to run out of beds. So as a city, we're trying to get about 150 beds on stream in the next couple of weeks to have that added onto the government's, what the government can provide, and it will be city run. With everything that I've said, as a city, we've had to really reach out to international partners, to local partners to support us, because revenue has been adversely affected. We were already as a city in a transition period from a very poorly managed city to our ambition for Transform Freetown. So we weren't quite there yet. So what we're doing, we've done because we've been able to get the support of many international partners, and want to use this opportunity to just say thank you to so many. So I think city leadership is coming through in our context, as it has done in so many other places in the world. And I hope that this has given some indication of how we're stepping in to help stop the chain of transmission. It's clearly not exhaustive, but it's a flavor. Thank you.